Hi, I'm Krista Hughes, the founder and CEO of Hughes Advocacy, in which I am a board certified patient advocate. I'm also an educator at the Leapfrog Judy Burroughs Education Institute, which is the educational arm of the Leapfrog Group. Leapfrog is an independent nonprofit organization that rates hospitals and ambulatory surgery centers on how safe they are for patients. So today I'm going to talk about lab tests and imaging, like your x-rays, CTs, MRIs. And this is very important information if you're age 55 and older. After this video, I want you to walk away with two big ideas. First of all is no news is good news is not a plan. And number two, your patient portal, plus a little help from AI, can make you safer and more confident. So the first one, don't rely on no news is good news. This happens all the time with my clients because tests get missed, results sit in inboxes, messages don't always go through, and your health is too important to leave to chance. So your rule of thumb is, if you've had a lab test, look for results in your patient portal within 2 to 3 business days. Some take longer. If you've had imaging, look for the radiology report between 1 and 3 business days. Pathology or special studies may take longer. If you do not see anything by then, send a message via your patient portal or call them. Lab results are usually available later that day. The second was use your patient portal like a pro. Open your portal and do these things every time. Find the results section, tap into the PDF or full report, and not just read the one-line summary. Look for red flags like H or L, which means high or low. Look for the word abnormal, which means range, the outside of the lab's range. And ranges can vary by lab, so always look at the range listed on your results. Now, if you're looking for imaging, how you read those is you check the impression results. This is the biggest thing with my clients. They try to read the entire radiology report. It means nothing to them. They think they found something. So to make sure you're getting the accurate information, you're to check the impression results. And to find those, you're going to scroll all the way to the bottom, and there will be at the bottom a section under impression. And that's when you're going to find the summary from your radiologist. Now, with your labs, you can track trends. Use the portal's graph to look for changes over time, like your A1C, cholesterol, or kidney numbers, because one odd number can happen and patterns do matter. Download and save your report and keep your reports in a folder or on your phone and computer, because this helps you especially when you go see new doctors. You can also message your care team with a question in your portal and ask, like, do these results change my plan? Do I need new medication or a follow-up test? And you can set alerts in your patient portal. All you got to do is turn on your email or text notifications so you know the minute your results are posted. And then third, let AI help safely and smartly. AI can make medical language easier for the layperson. Here's how you can use it as a helper, not a doctor. For the plain language explanations, you can paste a few lines, not your whole medical record, and ask, explain this in simple terms. It can help you build your question list off these results by asking AI, can you give me 5 questions to ask my doctor about these results? It can help you prep for second opinions by asking it to summarize this report in 5 bullet points that I can share with my new doctor. Now, here's a privacy tip. Remove your name, date of birth, any account numbers before sharing into AI. Never share images or PDFs that include identifiers unless you're comfortable doing so. Now, remember, AI is a translator and organizer. It is not your doctor. Always confirm with your care team. So here's a few real life examples from my client. And of course, I'm not using their real names. So number one, the quiet thyroid test. Kim is feeling tired and she gains weight. Her doctor orders labs. A week passes, no call. Instead of assuming the no news is good news, Kim checks her portal. She sees her TSH is high and her T4 is low, which is a sign of hypothyroidism. She messages through her portal, the clinic, and she said, I saw my TSH and T4. Should we start treatment? Her doctor replies the same day and prescribes the right dose. So the takeaway is Kim did not wait. She used the portal, she understood the flags, and she got care started immediately. Now, example number 2, the normal mammogram with a note. Ava's mammogram report appeared in the portal. The first line says no suspicious mass, but the impression report, remember that's at the bottom, mentioned dense breast tissue and recommended annual screenings and possibly supplemental ultrasound based on risk. Ava then took that impression note and put it into AI and asked AI, can you explain this in simple language and list questions to ask my doctor? AI gave her this information. What does dense tissue mean for cancer detection? Should I add ultrasound or MRI based on my risk? And Ava brought these to her appointment, and together her doctor and her decided on what was best and her next steps. That takeaway is the impression report from the radiologist with AI made her a question list for her to be able to talk to her doctor about to get a clear and safer plan. So here's a kind of a quick guide regarding common labs and what to watch for. So one of the common ones is A1C diabetes. When you're looking at that, look for trends over months and ask your doctor, do I need changes to food, activity, or meds? Cholesterol panel. Check your LDL or non-HDL, and you can ask your doctor, what's my goal and how will we get there? Kidney function. You want to look for creatinine and your EGFR. You want to track that over time, especially if you have diabetes, high blood pressure, or you take a lot of NSAIDs. And then last common one is a CBC, anemia, infection. If flagged for hemoglobin, ask what's the likely cause and what's my next step. Now, here's a quick guide on imaging and how to read that report. So for your X-ray, CT, MR, ultrasound, remember to scroll to the bottom to get the radiology finding. If you see wording like recommended correlation clinically or follow-up suggested, ask what action your doctor wants and when. For any incidental findings like tiny lung nodule or liver cyst, you need to ask your care team if you need any follow-up imaging. So kind of here's a 60-second checklist to use after any test. And remember, no news is good news. It is not a plan. Open your portal, go to your results, and go to the full report to get the PDF. Skim for flags and the impression and note any recommendations. Write 3 questions with AI's help if you would like. And lastly, message your care team that you've reviewed your results and do we need to change anything or schedule a follow-up. The bottom line, don't wait for a phone call. Check your portal, read the full report, use AI to turn medical jargon into plain English, and message your team with clear questions. That's how to turn results into action and keep yourself safer. For more resources, please visit the Leapfrog Judy Burroughs Education Institute. And if you have any questions for me as a patient advocate, please reach out to me via my website at hughesadvocacy.com. Thank you and have a great day.